So this episode was Grey's Anatomy, Season 2, Episode 25. Izzy is on some bullshit. Goes back to that management of care we talked about at the first day of the boot camp. This particular case study that you were given in boot camp, this is a case study that is dealing with his condition. So it's kind of pertinent to this episode. Now, so if we look at crazy ass Izzy, we see that she literally just like was lying, right? What did she do? Let's look at the physiology of it, because remember this right here? Physiological adaptation, that is part of your test plan. So that's what this whole paragraph is all about. So let's see what we remember about cardiac, okay? She told Dr. Burke that Denny's pulse ox was dropping. First she said 80s, then she said 70 to 80s. Okay, now we talked on the weekend that a pulse ox less than 90 was a medical emergency. So she's setting it up, isn't she? Now remember what I wrote. I wrote SPO2. What's another way of saying that? SAO2 is good. I heard pulse ox. That's better. Give me some more ways to say it. Starts with the S. What'd you say? Stat?
Wait.
Or rhymes with it?
Saturation.
Saturation. So O2.
Yeah, stat.
Sats.
Oh, sat, yeah.
Sats, yep, that's right. So saturation or O2 sats has been on your test, I swear to God. And the person that had it didn't quite know what that was. And this is what I see a lot of times with English second language. They're very concrete translators, so they may not know it if you do another name for it. So that's why I gave you a bunch of names. Why is this not exactly right, but it's close enough? Oh, very nice. So if it has a lowercase a attached to it, this actually would mean that blood was drawn in the form of an ABG. Agree?
Yes.
But it didn't. It had SPO2. So blood is a direct measurement of ventilation, but a SPO2 is a pulse ox, and it's indirect measurement of ventilation. Are you still with me?
Yes.
Okay, now she went on into great detail, and one of y'all had the question in y'all's U-World this morning about flash pulmonary edema. Let's think about that. So one of the things you're going to get good at is look at the phrase and think on your test, how would that look, right? Don't get all spastic like, oh my God, what's flash pulmonary edema? Why they put that word flash there? I don't know. The fuck?
It's okay.
It's okay, right. So pulmonary is what? Lungs. Edema is what? Fluid. Fluid is in the lungs. We don't have to go crazy here. You don't give a fuck about a flash or not. Well, you might, but it wouldn't be in this room. So you don't care. What you care more than anything is that these two you know very well. So don't spaz out over what you don't know. Literally hone in on what you know. So let's play what if. If this was just plain old simple pulmonary edema, what kind of lung sounds would you expect?
Crackle.
See, you know some shit. What color would the sputum be?
Yellow.
Pink. Who said pink? Raise your hand, you the
Pink
motherfucking
body.
shit.
Pink
Pink, frothy sputum. What medication would probably be great with this guy to get the fluid off the lungs?
Lasix.
Boom! You the motherfucking shit. In other words, this is not hard. You guys learned that in preschool. This patient would need a little diuretics, blah, 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 blue, blue, blue. Okay, here we go. You ready? She then lied and said he was on a nitro drip. But she didn't even think how stupid her lie was until Burke was like, oh, hell no. Because what kind of blood pressure did she give him?
82.
Now, I need you to tell me why nitro drip and 82/40 don't even make sense. What is the action of nitro? Vasodilation. Would we have him on a nitro drip? Because what does vasodilation do? It lowers, to all of those who said raise, where's my belt? It lowers the blood pressure. So watch this. Think about what blood pressure is, right? Remember this? It's the pressure, blood pressure. It's the pressure it takes to push blood through your blood vessels, right? Y'all good? Okay, so if you open up the blood vessels, it don't take as much pressure. But if you vasoconstrict the blood vessel like a cigarette does for a whole hour, then it takes a lot of pressure to push that blood through that vasoconstricted vessel. Y'all with me?
Yes.
Okay, so she got this motherfucker. So she said, she got this man, she said, on a nitro drip, nitro vasodilates. That doesn't make sense. What did he tell her? Shut that shit off. Get that off of him. And do what instead? Start him on a dopamine drip. Now, you are thebomb.com. You may not remember your dopamine. It's not like I would be mad at you if you didn't, but it is in your classifications packet that you have now from the boot camp. And what is dopamine anyway? It's a cardiac med, and how does it work?
Strengthen the contraction.
Yes, Barbie doll. It strengthens the contraction of the heart. Because if you rolling out with this pissy ass blood pressure, you need the actual strength of the heart to be more. Because you're not going to get this. Remember what we said? BP means blood perfusing kidneys. You with me? You ain't perfusing shit. So then strengthening your heart would help. Y'all good? Okay, so Dr. Burke told her, okay, this is what we doing. We're gonna go ahead and start that drip. You're gonna run some labs. You're gonna get that echo. And then he talked about a BNP. I hope you caught that. Did you catch that when he said it? You didn't think he said BMP, did you? You would never do that, would you? Nah, you wouldn't do that. You thought he said BNP. Now, what is BNP? B-type natriuretic peptide. Very, very nice. And what do we run this bad boy for? What is this blood test? The number one test to diagnose congestive heart failure. You working with me? You kind of got to know that shit for school. I mean, for your test. You got to know that. Like, you kind of like can't not know that. The BNP, or B-type natriuretic peptide, because it will be spelled all the way out. And this B stands for brain type natriuretic peptide, is a classic hallmark test for CHF. Because what we're saying, well, what Izzy is lying about, trying to say, is he's going into CHF, pulmonary edema. He needs his heart yesterday. We gotta hurry up. Go on and get that heart, because she's been told that the other guy died. I mean, it's real crazy. Okay, so that's what you're dealing with your patient's emergency, and she about to just be doing stupid on steroids. Now let's look at the actual patient. The patient's on an Lvad. You had to remember that Lvad meant left ventricular assist device. That is in your procedure packet. Pull it out. There's a thought. And if you don't have it, holla at your girl.
Can I get a pharmacology packet?
Pharmacology, I gotta do it today. Thank you. She didn't come in today. I gotta do it.
Okay.
Yeah, thank you, baby. But if you have your pharmacology packet, pull that bad boy on out of there. Procedures packet, yeah.
Okay.
So is it procedure?
What is an LVAD? Answer your own question. Cause your girl be drinking heavily up here, smoking and shit, getting high, using ketamine. Nah, I ain't that bad. But you good? Now turn all the way past your EKGs, which was past page 20. And somewhere along the way, you're gonna see something to say cardiac procedures. You do need a procedures packet, baby? Okay. Let me go get one for you.
It's actually before that. At the bottom.
Where's yours? Yes, you do. Yep. Lost it already, baby. I get you one, baby. It's up before this. Who said they needed one? This child legitimately does. Okay, now, so what you got, if you look under the procedures packet, you have, oh, it's on page 19, shame on me. On page 19, not after page 20, you can see all these little cardiac things, right? And then where's LVAD? Way down at the bottom, ain't that right? Yeah. Okay, now notice what I wrote. I wrote it could be an RVAD. That's much more rare. Usually it's an LVAD. Now you gotta be careful on the test because it wants to know that you know what the fuck an LVAD is. You can't say that an LVAD is an artificial heart. No, you can't, because it ain't. It's an artificial left ventricle. Again, left ventricular assist device. So what it does is it strengthens and uses this pump to create the same action a left ventricle would create. Now, you and I had a little fun this weekend when we did our EKGs, and we said it was that ventricular activity that gave you a heartbeat. Remember that? Mm-hmm. So it was the ventricular activity that gave you that pulse. Well, now, this patient who comes in with the LVAD, they don't have pulses. Because the pulse is on the outside of the body in the form of a LVAD pump. So it throws you off if you're not careful. I had one the other day. I'm like, I know your behind ain't gonna have no pulse. You ain't finna trick me, because they like to trick you. Because they know you look crazy when you can't find their pulse. The pulse is in the pump. Because again, their left ventricle is not really functional. So they may not have a pulse. Okay, don't freak out. All right, so this pump has one of two purposes depending on the patient. In Grey's Anatomy, it had a traditional purpose. Let me say that again. In this Grey's Anatomy episode, it had a traditional purpose. The traditional purpose of putting an LVAD into a patient was to bridge them, keep them alive, until we could get them a heart transplant. It was bridge therapy. And yes, you probably should be writing that shit. So this pump, the traditional original use for this was to bridge the patient to a transplant, to the point where they could get a heart transplant. Now that's hard because we have bazillions upon millions of people with CHF, and we only have so many hearts that go around in a country in a year to transplant. So consequently, what we found out, and it was a great revelation, was that, oh, there's another reason to give a patient an LVAD or an RVAD. And that is to enhance their quality of life and extend it on average 5 years, probably soon to be stretched to 7 or 8 years, because we just started putting these in people about 15 years ago. And now we're seeing they're still alive. And a lot of them are doing pretty fucking good. So now we use it as destination therapy, not just bridge. So some people might have one for bridge, trying to get themselves to the point where they can get a heart transplant. Others may use it as destination therapy, just to prolong their life and heighten the quality, because the patient who gets this LVAD is in pretty bad shape. And now when they get an LVAD, they can walk. A lot of them can even return to some of the normal things they could never have done before when they were so sick and challenged on activity levels. So you get it? You all right? Okay, now, so we have the patient, this is your patient, with the LVAD. Made perfect sense that the hospital administrator, or whoever the hell she was, brought in the DNR paperwork that was requested by him. This is a type of what? We learned it over the weekend. Advanced directives. So DNR is a type of an advanced directives. He's absolutely appropriate to want to do this. And who flips the fuck out? Now, she just told Dr. Bailey she was going to be objective. She was going to treat him like every other patient. The patient was the one that had to remind Izzy, isn't whether or not I do a DNR the patient's decision? And so that was a good example why you don't fuck your patient. You don't date your patient. You don't kick it with your patient. I mean, you know, if you needed a reminder, because some of y'all might be on some trash. I don't know. I mean, I did. I had a student who's, you know, fucking and second the patient, married him and everything. Don't get me started. Okay, now, so here, our other issue with the patient is that he actually joined the transplant list, unbeknownst to him, by the way, 17 seconds later. Remember the doctor said, might as well be 17 years. Remember she said that? Okay, so it's real important that you hear me on this. This patient ended up on the list 17 seconds later than the one who is waiting for the heart. And that other patient was on a Dobutamine drip, and that's important because these two drugs are a lot alike. Now I need you to think, if you can, and it's okay if you cannot, tell me what the difference is between those two drugs. Anybody? Without looking it up, of course. But anybody think they kind of know? That list is not supposed to even be out.
I was highlighting.
Wow, I don't know. My child, I ain't even mad at you. Y'all should be highlighting that motherfucking them lists. Okay, but so what's the difference, y'all? Do you know? She actually doing the right thing, and I'm fussing. What's the difference, y'all? Can y'all tell? Okay. Some of you may have your medication categories if your balance is 0. And if it is, it will tell you that this one vasoconstricts and dilates renal arteries, dopamine. Dobutamine does not vasoconstrict. So it doesn't cause the patient to have tachycardia, which is very taxing of the heart. And it doesn't dilate renal arteries. So if you give a dopamine drip, your patient's gonna have to pee. It's a great one if your kidneys are failing. It will help you pee. Okay? Both of them can treat shock. Both of them. But they are not alike. And that's the point I'm making. I put one in red, I put another in blue. Yes, baby.
The one in blue, you said it doesn't do what?
It doesn't vasoconstrict,
Okay,
which makes it safer. To be honest with you, back in the day, Back when I was like Nancy Nurse, dopamine was the drug of choice. It's no longer the drug of choice. Dobutamine is more usually selected because it doesn't stress the heart by causing tachycardia. Vasoconstriction always will cause tachycardia. Isn't that right, everybody? You knew that. Okay, so we have crazy ass Izzy line. We got the patient here. And then we have the donors. Let's look at the donors. The two donors were who?
Brothers.
They were brothers who got in an accident, weren't they? Trying to outrun a train or something. They were saying a truck, I think. A semi, yep. Why do you care that they were brothers? What pertinence does that have to your test? Because you know I pick up on everything. I know you don't, but I do. That's what you pay me for.
Blood type?
Brothers, siblings, let's say, are more genetically alike than anyone else in the world. So you match your sibling more than you match mom, your kid, dad. Siblings match almost 100%. The reason why you care is so that you don't think the writer was on crack when he said both the donors are a match. Makes sense, because siblings match anyway. They're very much alike. My brother and I are very much the same blood type. Okay? And what is the best blood type for a donor to have? Oh, what?
Negative.
Oh, negative. What's the best blood type for the recipient to have? AB positive. Transplants are exactly like blood transfusions. Let me say that again. Transplant success is a lot like blood transfusions. So the same thing that applied to donor and recipient for blood transfusion, which means the best person to donate blood is O negative. The best patient to donate an organ is O negative. The best person to receive an organ is AB positive. And the best person to receive a blood transfusion is AB positive. Are we good? That's another tip, because you kind of want to know that for your test, okay? Now, this motherfucker coded. When he coded, you saw some things you learned this weekend. What was happening when you watched the code? There was hands laid on the man, wasn't it, y'all? You saw her doing the chest compressions, because we said when you get this patient, you didn't walk in with paddles ready and pads on. Lay them hands. Lay them hands on that patient as your first nursing action. Then we defib, then we epi. 1 minute, 2 minute, 5 minute. 1, 2, 5. I mean, it was classic if you paid attention. Right? So by 1 minute, you should have laid hands and did chest compressions. By 2 minutes, you should have got that defibrillator and started shocking. By 5 minutes, you should have given epi. This is ACLS, BLS type shit. Basic life support, advanced life support. Y'all good? But this is very important. Okay? Now, that damn dingbat and Izzy, fuck. What did her punk ass do? And then gonna get an accomplice. Come on in here, O'Malley. You just blocked the door, baby. While I cut this motherfucker's cord. What? It's absolutely insanity. But it's a television program, so it was perfect, wasn't it? Okay. Now, why did I pick this episode specifically? Well, as you know, I'm always up on the latest news, and I told you that there's really only a couple excellent sources of news out here because so much is bias. I told you I followed the New York Times. That's on my phone with alerts. Just for the purpose of alerts, because I don't find them completely non-biased. I do not find them completely non-biased, but they have really good alerts. CNN alerts are on my phone. New York Times alerts are on my phone. But I follow the New York